Hello, good evening everyone. Hi, welcome to our Facebook Live on Nursing Prioritization and Delegation tonight, everyone. So thank you very much for being here. We have been looking at some of the comments, and one of the things I want to tell you right now is that we have one NCLEX passer. Her name is Nona Barles. So Nona actually passed the NCLEX this October, just really recently. She passed her NCLEX-PN. Okay, so before anything else, everyone, I would like to introduce myself. My name is Mr. Alan Matus, and I am a nurse educator for almost 25 years, and I have been helping nursing students pass their NCLEX examination. I'm also a nursing faculty, and also I'm the founder of Matus Nursing Review and Matus Nursing Review Online NCLEX Academy. And also, I'm an author. I published a book entitled or titled Simple, Fast, and Easy NCLEX Review, which you can find in Amazon and other online stores. Okay, so tonight I have prepared several sets of questions, and it's going to be a little bit of a different approach tonight. Okay, in the past few weeks, we have been focusing on having 4 patients who are unstable, and then you have to choose the patient who will be the priority. However, for tonight, it's going to be a different approach, everyone. So for tonight, the focus is going to be more of application, more of the correct nursing action to be done in the particular situation. Okay, so without further ado, let's welcome some people here. We have welcomed some people already. We have Che. Good evening. Okay, and then we also have Amber. Amber is already an NCLEX passer. However, she still attends our program every Thursday. So this program is being held every Thursday, 7 to 8 p.m. That would be Pacific time. Every Thursday, 7 to 8 p.m. Pacific time. And we focus our concepts here on delegation and prioritization, and maybe some NCLEX updates as well, everybody. Okay, so we have the first agenda for tonight. I want to share again our motivational photo of the week, which was sent to us again by Sharon. So Sharon sent us this photo, and she just came from work, and you can see that she's watching the video on delegation and prioritization in the online academy. And I think that's lemon on the in the cup, I guess. Okay, so thank you very much, Sharon, for sending us the video. We have hundreds of students in the online academy, and they are on their way to passing the NCLEX examination. And of course, our session for tonight will not be complete without our testimonial. Okay, so we have also Revelo Arnold for tonight, and she's from the Philippines. Also, we have Jemlyn also. Hello, good evening. Okay, thank you very much. All right, so Nona actually just really passed the NCLEX recently, and this is what she's saying. Okay, as of October 26, she said, I just found out today that I passed. Sir Alan, thank you so much. I did enroll myself with Sir Alan every Saturday class. It helped me to understand the concept. Plus, every Thursday, the Facebook Live with Sir Alan made me understand the concept that it is not hard to remember. And every Saturday, the class is fun. Always have funny story on the site. And Sir Alan, thank you so much. You're one of the people who helped me with my journey to get my license again. Thank you. So I highly recommend Matus Nursing Review. Thank you very much, Nona, for that very nice recommendation. You're one of our NCLEX passers now, NCLEX-PN. I know that you have a career already right now. However, having a license will propel your career into a much broader and promising horizon. So congratulations again for passing the NCLEX. And I hope the others will also be passing soon as well. Okay, so we have to welcome also Joanna. So Joanna Manalang is from Ohio. So welcome here tonight. Okay, I think I have been talking to you, Joanna. And okay, so nice to see you here. We also have Anusilia Ninita. Okay, so we have another. Miriam also is here tonight. We have a lot of people joining the session. And you can also say, I think Miriam is from Hawaii. And Roby, also another student that we have tonight. Now, I have one big announcement, everybody. Okay, November 1, we're going to have your Halloween again. So we do this once in a while. Okay, our limited promo. So that would be 50% off our 1-year unlimited online access NCLEX review. Not only NCLEX-PN, that would be on online NCLEX-RN or NCLEX-PN self-study review program. So if you want to have access to all of our videos and do a self-study, then you can have a 1-year access, which is $249. Normally that is $499, but then we're slashing that half off. That would be $249.50 only. Okay, you can enter the coupon code 50 half off in order to pay only $249.50, and this promo will end in November 1, 2020. Also, that would be 12 midnight. Okay, so this is a limited time promo only, everybody. If you wish to grab this opportunity, then visit our website at matusnursingReview.com or matusnursingreviewacademy.com. Okay, and we don't know when is going to be the next sale again, everybody. Okay. All right, of course, before we proceed, I would like to request everyone so that your friends can also benefit from this program. You can share the live video, or you can also click subscribe if you're watching this in the YouTube channel, everyone. And of course, for tonight, we will never forget this. Okay, so we will have the announcement of our winner for the 90-day online access NCLEX review. So those who joined last week, we did a little bit of raffle online, and then we have the name of the winner tonight. Okay, so free 90-day online access review. We're going to announce the winner at the end of this program. Okay, all right. So let's now proceed to the first question, everybody. I hope everyone's ready now. Okay. All right. It's getting cold out there, everyone. And you can also put your comments or your questions in the chat box, everybody. Okay. Or in the comment section. So our first question for tonight is going to be more of application question. It's going to be question in the NCLEX that will ask you what is the best nursing action that you're supposed to do, or what is the priority nursing action that you have to do. So what is the most important concept that you need to remember about that? Okay, lately I have been teaching my students, and have noticed also that some of them are struggling with this approach in the NCLEX, with this kind of questioning. So let's try to find out if you can answer these questions. Okay. All right. So number one, everyone, get ready, everybody. And if you can say yes in the comment section, I would appreciate that. All right. And then you can put also your location if you want to. And I'll give you a shout out in this Facebook Live, everyone. So the first question, everybody, let's see. This will be a little bit different than what we had last week. Okay. So our first question will be, after the change of shift report, the nurse checks the client who just returned after a cardiac catheterization and finds a large amount of bright red blood in the bed sheets. Which of the following is the initial nursing action? A, notify the healthcare provider. B, check the insertion site in the groin area. C, assess the blood pressure and pulse rate. Or D, elevate the client's leg. Okay, so I'll repeat the question. After the change of shift report, the nurse checks the client who just returned after a cardiac catheterization and finds a large amount of bright red blood in the bed sheets. Which of the following is the initial nursing action? A, notify the healthcare provider. B, check the insertion site in the groin area. C, assess the blood pressure and pulse rate. Or D, elevate the client's leg. Let's see what will be your answer in this question, everyone. Okay, so most of you have almost the same answers. Okay, can you put the rationale? Why is that the answer that you have put? Okay, let's see. All right. Okay, so we have people now putting their answers. So let's have the answer, everyone. Okay. All right. So one of the things that you will encounter in the NCLEX will be questions about initial nursing action. So let me elaborate a little bit more about this, okay? When you say initial nursing action or priority nursing action, for example, you always have to remember that you have to use the nursing process, of course. And what is the nursing process? Assessment, planning, intervention or implementation, and then the last one will be evaluation. And your initial instinct when you say initial nursing action will be to assess, of course. Okay, so in the NCLEX, when is it advisable, or when is it appropriate or correct to assess first and then you intervene? Or is it possible in the NCLEX that you skip assessment and then you just intervene right away? So in what situations can you answer assess? In what situations can you answer intervene or a nursing action? And always remember, when you say a nursing action, it could be assessment as well. So I always tell students that if you don't have enough information in front of you in the situation, okay, if you don't have enough information, then maybe you need to assess first. Okay, maybe you need to assess first. But if you have the information in front of you, it's in the situation, and it is complete, okay, and you know the client is in danger or the client is in severe distress, then you have to intervene right away. So in the NCLEX, before you call the doctor, there could be usually a nursing action that you have to do first. Okay, so let's find out in this question, what will be the answer? Is it notify the healthcare provider, checking the insertion site, assessing the blood pressure, or elevating the leg? Okay, so the answer to this question is going to be, let's see some of the rationale. Okay, if in emergency, Akosua said, you have to intervene. That's what she said. Okay, Benedicta said, bleeding is happening, so you have to do assessment first. Okay, every time there's bleeding, you have to check first. Okay, we have to assess the site of the incision or the insertion site for possibility of bleeding. Okay, so the answer to this question, okay, let me see if everybody's correct. The answer is going to be letter B. You're all correct, everyone. Congratulations. All right. So in this question, everyone, you're doing your rounds and then you saw your patient having bright red blood in the bed sheets. You don't have the full information on what's going on, but you know certainly that there is a serious situation that's happening. We will eliminate letter D because that is an intervention and we have to eliminate that. So the answer is going to be checking the insertion site first. You have to do an assessment. Letter C is correct, assessing the blood pressure and the pulse rate, but is that something you have to do right away? Is that something you have to do? That's also an assessment, but is that something you have to check immediately? The vital signs? You can do that, but first and foremost, looking at the situation, you have a client who is having bright red blood in the bed sheets. You have to check the insertion site in the groin area for possible bleeding. So this is one thing that I would like to tell you in the NCLEX, that I'm not saying that calling the provider is wrong, but before you choose calling the provider or notifying the provider as the answer, you have to find out first if there's something that you can do in order to promote patient safety. We all know that cardiac catheterization involves insertion of a catheter into the femoral artery or the vein, and the catheter goes into the central circulation or into the heart to visualize the heart chambers. Okay, and after the procedure, it's very important to assess and to prevent bleeding from the insertion site. Okay, so in this situation, that's the answer. Checking the insertion site in the groin area. And then after you check that really what's going on, then you have to intervene. If there's a large amount of blood coming out from the insertion site, what are you going to do, everyone? Are you going to check the vital signs or are you going to stop the bleeding? If bleeding is happening after you check, then you have to stop the bleeding first. Okay, if there's dressing, you have to reinforce the dressing. Okay, stop the bleeding, and maybe after that, you have to find out if your patient is doing okay by checking the vital signs. Okay, and then after everything that you have done, then you can notify the healthcare provider. Okay, so remember that, everybody. And also, one of the things that's important is that you should at least know what cardiac catheterization is and what is involved in that procedure. Okay? All right. I'm not saying that calling the provider is wrong, but always find out first among the options if there's something that you can do. And anyways, NCLEX is an examination that test you or that will test you if you will be the kind of nurse who knows what to do first to the patient even before calling the physician. Okay, so if worst comes to worst, you don't have any other choice, then maybe you can call the physician if you after you have looked at all of the options, everyone. Okay, and always remember your nursing action must be the correct one. So in this situation, we can answer the initial action is assessment. Okay, I'll give you another example. For example, you enter the patient's room and the patient says, I have back pain. All right, I have back pain. That's what the patient said. My pain is so severe, it's in the back area. Are you just going to give analgesics? Are you just going to give pain medications? No. What you're going to do first is to assess further a little bit. Okay, you have to do your pain assessment. You have to ask the patient in which part of the back area. You have to ask the patient the characteristic of the pain, the onset of the pain. You have to get a little bit more information. Okay, especially if it's just a situation wherein you don't have the full information and you need to get more. You have to do a little bit of assessment to see what's going on. Okay, all right. So that's the answer, everyone. So be very careful. Okay. All right, so let's proceed to the next question, everyone. So Nona is commenting and she said, the Facebook Live really helped everyone to pass. Okay, very good. Thank you. And we learn from our mistake. It's a different technique if someone is explaining to you the rationale to the questions. I know that you can be in your computer as well, you're answering, you're reading the rationale. But another way to learn is to listen from someone, to interact with your classmates so that it helps you develop your critical thinking, everyone. Okay? All right. So let's have the next question, everyone. Let's see what will be your answer. So this is another application question. So a client in labor tells the nurse that her membranes ruptured and she felt that something slipped through the vaginal canal. Upon inspection, the nurse determines that the umbilical cord has slipped and is protruding at the vaginal opening. What is the priority nursing intervention? A. Assess the client's uterine contractions. B. Place the client in knee chest position. C. Perform nitrogen vapor test. Or D. Cover the cord with moist sterile dressing. So again, I will read the question. A client in labor tells the nurse that her membranes ruptured and felt that something slipped through the vaginal canal. Upon inspection, the nurse determines that the umbilical cord has slipped and is protruding at the vaginal opening. What is a priority nursing intervention? Okay, A. Assess the client's uterine contractions. B. Place the client in knee chest position. C. Perform nitrogen vapor test. Or D. Cover the cord with moist sterile dressing. Okay, so what's the answer to this situation? Recently, this has been my topic, my lecture with my students. I've been discussing with them cord prolapse, and we all know that cord prolapse is one of the favorite situations that they have in the NCLEX. So cord prolapse means that the cord falls down into the vaginal opening. Cord prolapse could be occult or not visible. It could also be visible cord prolapse as well. So in this situation, it is a cord prolapse that we can visualize. Okay, or sometimes the nurse can feel the cord, okay, in the vaginal area. So let's see what's the answer to this question, everyone. Okay, so the answer to this question, everybody. All right, so I have a question to everyone based on your answers. Now, in this situation, do you think the patient is in danger? That's the question. In the first question that I gave you, the nurse just finds blood in the bed sheets. It doesn't tell you anything about if the patient is cyanotic, anything like that. But in this situation, it's a little bit different. The question you always have to ask when you're being asked of priority intervention is my patient in danger, or something bad will happen if I don't do anything? Okay, should I assess or should I intervene? That's the question. Okay, so and at the end of the day, it's really going back to the content, going back to the pathophysiology that will guide your answers all the time. Okay, that will always guide your answers. So when you take the NCLEX, always make sure you know pathophysiology of different priority conditions. Is understanding the content very important. So the answer is going to be, okay, so Charlene said, you have to position the patient first. Okay, that's what she said. All right. Okay. So the answer is going to be, all right. The answer is going to be, all right, everybody. The answer is going to be letter B, everyone. Okay. So letter B is the answer. A client in labor tells the nurse that her membranes ruptured and felt that something slipped through the vaginal canal. So the first thing that we have to do here is to remove the pressure from the cord. If you remember cord prolapse, when the cord falls, one of the things that can happen is that the head that is descending, the head can compress on the cord. And always remember that the umbilical cord is the pathway for blood circulation to the fetus. So if the head is compressing on the cord, that will reduce the oxygenation of the fetus. So what is the priority intervention? We have to relieve the pressure from the cord as much as possible. And if you go back to your content, if you go back to your books, what do they tell you? What you can do is definitely position the mother in knee chest position. You have to elevate the hips. The head should be lower than the body. The head should be lower than the body. You can put a pillow under the hip. Place the mother on a left side lying position, as long as the goal is that the head is lower and the hip is elevated, everyone. What you can also do is push the head a little bit. Put pressure on the head, because the goal is to relieve pressure from the cord. However, as you're doing this, you have to make sure that you also communicate with your team members to call for help and arrange for a possible cesarean delivery as much as possible, because your cord prolapse is an emergency situation. Okay, now letter A, assessing the client's uterine contraction that is not needed at this time. Letter C, perform a nitrazine paper test. A nitrazine paper test is only being done if we are not sure if the membranes that ruptured or the fluid that came out is urine or amniotic fluid. That's a testing for finding out if it's amniotic fluid or urine, for example. So that is not important in this situation, the letter C, the nitrazine paper test. The letter D, covering the cord with the moist sterile dressing, is not something that we discuss in the content. No, it's not. So it's not A, it's not C, and it's not D. One possible thing that you can do also in this situation is to check the fetal heart rate later on. Okay, to check the fetal heart rate, making sure if the baby is doing okay, if there's any variable decelerations. Okay. All right, so the best answer is going to be letter B. Now, my advice to you, everyone, is that all of you guys, when you're studying your book, put a star on any priority or emergency situation and really study those emergency situations. Okay, what are examples of emergency situations in maternity nursing? You have amniotic fluid embolism. You have eclampsia, when there is convulsion. That's an emergency situation. What about if you have cord prolapse, for example? Okay. What about a sudden vaginal bleeding? So when you study your book and when you're reading different diseases, you have to ask yourself, is this an emergency situation? Is this a priority condition? Is this a serious condition? Then you really have to put a star, because in the NCLEX, you will be asked about the most common interventions for emergency situations. Okay? All right. So that's it, everyone. The lesson that we have for tonight is basically really knowing when do we assess and when do we intervene. At the end of the day, we are guided by our very principle or concept that patient safety is number one. Okay, before you click assess the patient, you have to ask yourself, okay, can I waste time assessing, or is something dangerous happening while I'm doing the assessment? Okay, so you cannot do assessment if your patient cannot breathe. You cannot do your assessment if your patient is in danger. You have to act immediately, and then you check the vital signs, and then you check the patient. Okay, but first you have to stabilize the situation. So again, be very careful. Okay, our key concept for tonight, our takeaway is this: before you click assess, make sure that you really need to assess. Okay, or maybe you should intervene first. Always look at your patient. All right. Okay. So very good, everyone. Because that's going to be a very common situation in the NCLEX. Because that's a real life situation also for nurses. Okay, knowing what to do when there is an emergency situation and reporting change in condition. Okay, so for tonight, we're going to have your another question. We have your another question. I don't know what happened with the question, everyone. I was supposed to click the question, but then I think I deleted it. Okay, but anyway, we have a delegation question for you tonight, everyone. Okay, so maybe I could still okay. Let me see if I could still get that question for you, everyone. Hold on. Okay. So let's see. Let me upload the question and show it to everybody. Okay. So let's have the question. Okay. So maybe I got the question here. All right. So let me show it to you, everyone. So this is our delegation question. Let's see. All right. So delegation question for tonight. All right. Okay. If in distress, do not assess. Of course, if the client is in distress, do not assess. A very good example of that is you enter the room and then the patient is having a hard time breathing. Then the first thing you really have to do is get the oxygen probably, or reposition the patient, elevate the head of your patient. That is something that you can do. Intervene first. Okay? All right. All right. So let's proceed. This is our delegation question. The registered nurse works with the unlicensed assistive personnel, or UAP, and licensed practical nurse, or LPN, in caring for a client with opioid-induced constipation. Which of the following tasks can be delegated to the LPN? A. Administer milk of magnesia as ordered. B. Explain diet on how to prevent constipation. Actually, guys, this is a select all that apply question. I'm sorry. Okay. So explain diet on how to prevent constipation. C. Assess response to narcotic administration. D. Help the client to ambulate to the bathroom. E. Document number of bowel movements during shift. Or F. Auscultate bowel sounds. Okay. Again, which one can you delegate to the LPN? The registered nurse, or RN, works with the unlicensed assistive personnel, or UAP, and licensed practical nurse in caring for a client with opioid-induced constipation. So which of the following tasks can be delegated to the LPN? A. Administer milk of magnesia as ordered. B. Explain diet on how to prevent constipation. C. Assess response to narcotic administration. D. Help the client to ambulate to the bathroom. E. Document number of bowel movements during shift. Or F. Auscultate bowel sounds. Okay? For international nurses, it's very important that you know these concepts. Okay? Especially the role of unlicensed assistive personnel or nursing assistants. Okay? So what will be the answer to the question, everyone? Okay. Okay. So put your answers, everybody. Okay. Delegation. Always remember the responsibilities of the UAP should be simple and routine only. Okay. So the answer is going to be, okay, so we still have some people answering at this time. Okay, we'll wait for them. Okay. All right, so we have different answers in this question, and that's really very interesting. All right, I'll give you a clue. Okay, of course, letter A is included, but what else do you think is the answer? Okay, so analyze the question. When you do select all that apply, you have to choose the process of elimination. Okay, now I would like to tell you everyone, in terms of delegation, okay, or in terms of select all that apply in the NCLEX, don't forget the new rule that came out the last few years, okay? It's possible in the SATA, in the NCLEX, that you only have one answer. Can you remember that, everyone? Or in the NCLEX, it's also possible to have all correct answers. So in this situation, how many answers do we have? One, more than one, or is it everything? So the answer to this question, everyone, is going to be, okay, we have different answers, everybody. Okay, so in this situation, remember in this situation, RN, LPN, and UAP are working together. Okay, so which one will you give to the LPN? The answer is going to be very good. That would be A and F, everyone. So congratulations for those who got the right answer. Okay, all of you got letter A right. Letter B is wrong. It's not included. Why is B not included? Because B is for the registered what? Nurse. Okay, explanation or teaching, that's for the RN. Always remember our mnemonic. That would be evaluation, assessment, and teaching. And B is teaching. So that's why we do not include that. Letter C, assess response to narcotic administration. Assessment, especially evaluation. That's assess response. That would be the responsibility of the RN, okay, to assess the response to narcotic administration, especially evaluating the physical reaction of the patient to the narcotics. Now, letter D, help the client to ambulate to the bathroom. That's a task for the UAP. That's your activities of daily living, assistance with ambulation, as long as it is a stable patient. Okay. Now, if it's an unstable patient, the UAP cannot ambulate the patient to the bathroom. Okay. If it's a patient with unstable cardiac arrhythmia, for example. Okay, but letter D is fine. Now your letter E, document number of bowel movements. That is something that UAP can do. You know, they document bowel movements, they measure intake and output. So that's the answer. Letter E is for the UAP. But letter F, auscultate bowel sounds, that would be for the LPN. LPNs, as what I have told you the last time, everyone, LPNs can also do assessment, but you only call that focus or specific assessment. And an example of specific assessment would be checking the placement of the tube feeding, okay, checking the color of the wound, or listening to bowel sounds, or checking the heart rate, for example. Okay, so, but comprehensive assessment or in-depth assessment or initial assessment, especially when there's a changing condition, that would be for the RN. So we have A and F. So congratulations for those people who got it right. So we have A and F as the answer to this question. So learn this, everybody. Hopefully that when this comes out in your NCLEX, you will remember it, everyone. And never forget the task that you can delegate to the UAP. Okay, so this one is for LPN. All right, are you ready to another question that we have for tonight? Okay. Okay, so we have another one. So what education can an LPN give to the patient? The LPN, as what we have discussed in the past, generally LPNs can also teach, you know, but only more of reinforcement or reminder. Okay, and a very good example of that would be, for example, if the RN teaches a patient with a new colostomy about colostomy care, everything about colostomy, the RN will do that. teaching the patient. But then the LPN can reinforce the teaching, for example, on how to make sure washing the hands before colostomy care. So more of reinforcement or any routine education. The education must not be complex. Developing the teaching plan is the responsibility of the RN definitely, but the LPNs can do reinforcement of education. Okay? All right. So in the NCLEX, remember the NCLEX is the ideal world. Okay, so some of you are commenting there about the LPNs are doing this also in the nursing homes. Always remember that in the hospital, LPNs work under the supervision of the RN. The same thing in the skilled nursing facility, but sometimes LPNs have some additional independent responsibilities or freedom in the skilled nursing facility. Okay, and you can see that everyone. But when it comes to the NCLEX, you always have to follow what's on the textbook. Okay, what's in the textbook, the ideal world, everyone. Okay, so let's have, okay, so Kelly Johnson, okay. All right, so let's proceed. So number 4, everybody, we have now, okay, the last question for delegation, everyone. Okay. The registered nurse or RN and unlicensed assisted personnel or UAP care for a client with diarrhea due to Clostridium difficile infection. Which task should be delegated to the UAP? Select all that apply. Okay. A. Collect the stool specimen. B. Assess skin turgor and blood pressure. C. Measure intake and output. D. Apply lotion to irritated buttock area. E. Answer client's questions on need for NPO. Okay, again, the registered nurse and unlicensed assisted personnel or UAP care for a client with diarrhea due to Clostridium difficile infection. Which task should be delegated to the UAP? Select all that apply. Okay. All right. A. Collect stool specimen. B. Assess skin turgor and blood pressure. C. Measure intake and output. D. Apply lotion to the irritated area or buttock area, irritated buttock area. E. Answer client's questions on need for NPO. So what's the answer, everyone? Okay, let me see. What's the answer of everybody? Which one can be delegated to the UAP, everybody? Okay, UAP, what can you delegate? Let's see if most of you got that right. Okay, let's see. Always remember that UAPs can also measure vital signs. Remember that. Routine vital signs. Routine vital signs could be given to the UAP. Okay? All right. So, the answer to this question, everyone, will be okay, so this is usually very challenging in the NCLEX because UAPs have different tasks and responsibilities in some states. So sometimes it's really very tricky, but as much as possible, when NCLEX questions are created, the goal usually is to set a national standard and to really make sure that there is no confusion among examinees, because we recognize or realize the fact that there are some differences in the practice of UAPs in different states. But generally, we have to stick to the core concept about UAPs, that they're supposed to be responsible for simple tasks, routinary tasks, non-complex tasks, which involves activities of daily living. Okay, and sometimes in the NCLEX, you may also be asked questions about what an experienced UAP can do. Okay, so the answer to this question, everyone, will be letter. Okay, so the answer, everyone, is going to be letter A, C, and D. So I think some of you got the answers right, or most of you got it right. Very good. Okay. So we have A, collect stool specimen. C, measure the intake and the output. And D, apply lotion to the irritated buttock area, especially if it's non-medicated. Okay. If it's a prescription lotion, then definitely it is not something that the UAP can apply to the buttock area. But if it's just a skin lotion, a regular skin lotion, then you can apply that. So A, C, and D. Your letter B, assessing the skin trigger and the blood pressure, is responsibility of the RN. And your letter E, answering the client's questions on the need for NPO, that would be the responsibility of the RN. Okay? Or maybe in this situation, you probably can say that the UAP can remind the patient to be NPO, can just remind the patient to be NPO as part of the healthcare team. But to really explain why the patient has to be NPO, then that's the responsibility of the RN, everyone. Okay? All right. Okay, so we have some serious conversations in the comment section, and I really believe in that. Okay, or can relate to that because I used to work also in skilled nursing facilities, and I work well, very well, with some of my certified nursing assistants, and they are really awesome, especially when we have surveys. They're always on top of the game. Okay, well, thank you very much, everyone. I hope that you learned something different for tonight. And before anything else, you can put in the comment section, what's the best thing that you learned tonight, everyone. Okay, all right. Okay, so we have okay. So we have, okay, so just say, I just want to plug this in. This is my book that you can find in Amazon if you want to buy it. That's a simple, fast, and easy NCLEX review book. Okay, and of course, it's something that a lot of my students have been using, and they passed the NCLEX because of this book. And I'm really very happy about the outcome of this book, how it's helping the students. Okay, so it's on Amazon, everyone. And then also just a special announcement. We have an upcoming webinar starting next week. That would be November 7 to January 16, 2021. That would be a 10-day live comprehensive NCLEX review webinar. So I'm sending out the workbooks this week, okay, so that the students can receive them by November 7. So the class is confirmed. Okay, and part of the enrollment also is that you have access to the online academy for 6 months from the time of enrollment, everyone. So every Saturday from 8 to 4 p.m. That's going to be exciting. So I'm going to be having a live webinar with my students. Okay, all right. So thank you. So are you excited, everyone, to see who won our contest? Okay, let's see. So Anucilia's Ninita said that she got my book. Thank you very much for having my book, Anucilia. Hopefully that you can leave a review in Amazon if you're liking it. Okay. Thank you so much, sir, for the nice explanation and the clear the concepts of every question. Thank you. Okay. All right. So everybody, the winner for the giveaway, everyone, is going to be our winner for tonight. This person attended last week. Okay, that would be One Night Dennis. Okay, Walnut or One Night Dennis. I don't know how to pronounce the name, so please just excuse me for that. But congratulations. Let's congratulate Dennis for winning tonight. And I know that some of you are really hoping that you will win as well, the 90-day online access. But anyway, everyone, I still thank you for joining this session every Thursday. I know that you're spending your time with me instead of being somewhere else. And I'm really very happy about that. And again, my special message to everyone is that the holidays are coming. So it's coming, and I want you to be safe. And again, I'm always very happy that you find this program helpful. So again, our goal is to master your delegation and prioritization, and of course, to make everything simple, fast, and easy for you, everybody. And you can also watch this session that we have in our YouTube channel, everyone. So thank you very much, everybody, and have a good night, everyone. Thank you.